topic is today Venom and Fangs, the nurse's role in bite and stings. So this is my roadmap actually, the nurse's role. First of all, I'm going to highlight of my short discussion the basic emergency care practice in nursing level and especially the management of anaphylaxis. In addition, proper documentation is very important and update the documentation, especially the BHTs and ICU charts. Next one will be take action to minimize the absorption of toxins, especially the wasp bite and those things. And nurses should learn how to correctly perform the whole blood clotting time 20 minutes. In addition, correct dissolution of anti-venom. So first of all, I'm going to highlight the gravity of this problem in Sri Lankan level. The sources has been taken from Health Ministry. There are about 80,000 bites annually, snake bites, and 30,000 envenomation that we have to give anti-venom. And around 400 deaths annually. That is also very important thing. So more than one patient is dying daily because of the snake bite complications. So most of them are young, productive, and they are breadwinners. So a lot of burden to the society and the family. In addition, in insect bite, 15 to 30 deaths annually reported. Those are latest sources from Health Ministry. So mainly mortality and morbidity mainly due to anaphylactic shock on admission or while the patient is given ABS. In addition, respiratory failure related complications, acute kidney injury related complications, and myocarditis and rhythm abnormalities. In addition, hematological and neurological issues. So proper nursing care can minimize mortality and morbidity. So nurses play a very vital role in emergency care. So what are the basic principles in a nursing level? Proper monitoring is very important, vitals, and update the clinical charts. As I mentioned previously, so the updating is very important. So the clinician can take urgent decision and timely decision to prevent further complications. And in addition to that, be vigilant about the alarming parameters like the patient's low blood pressure, rhythm abnormalities, reduce our output. That should be charted in the monitoring chart. So very easy to take the decision once we glance the chart. In addition, maintaining of emergency medicine stocks is an antidote here. So daily, the in-charge sister or in-charge nurse in the ward should always check daily the emergency trolley, adrenaline, antihistamine, hydrocortisone, those things are available, as my previous colleague mentioned. And in addition to that, basic apparatus like laryngoscopy and antidote also, snake venom, anti-snake venom, and other antidotes. So this is the one of chart that I taken from international journal. Very basic things are there, but it's very important and life-saving. In general examination in a nursing chart, temperature is very important. So clinician can take decision by seeing the general examination chart, pulse rate and pulse rhythm and those things, respiratory rate, fluctuation of the blood pressure, saturation, and emergence of neurological signs and change in the urine output and other remarks. So other remarks, experienced nurse can document other remarks as well. Especially in a snake bite patient, local area management also very important. Otherwise, they will be candidate for compartment syndrome and amputation. So swelling of the bitten part, in addition to that, local pulse in the bitten part, and capillary filling and bleeding and those things. If those things are well measured, documented and updated, as I mentioned previously, and if pulse volume is good in the morning, if pulse volume is low in the afternoon, so there is something going wrong. So that should be updated to the clinician, and the clinician can take the due decision. Very important is, as I mentioned, updating. So this is also very important, wound care. So in a snake bite case, especially wash with a soap, with a running water. That is also very important. That will eliminate a lot of poisons if bitten has taken recently. In addition to that, it is advisable to cover clean dry bandage. And removal of any jewelries and tourniquet. Tourniquet is usually applied by our laymen in the village, and that should be immediately released to prevent the ischemic injuries. The picture 1 shows the correct way of washing the affected part. Picture 2 shows the victim of a hump nose viper. Usually they come as blisters. If blister is not ruptured, this poor candidate, now he was a candidate for amputation because of the ischemic damage. And basic principles of wound debridement. Actually, most of our nurses will know that part. And it is advisable to rupture, sterile rupture of the blister of especially the hump nose. So that can minimize the pain as well as the progression of the ischemic damage. So the pressure will be released from the blister and pain will be minimized. And in addition to that, ischemic damage will be controlled. So this is also a very important part. Nurses' role in minimize the absorption of toxins in sting bite. So most of the village people, laymen, they remove the sting by dragging it out. So always that should be avoided. Avoid squeezing and pulling the stinger up, pulling up and remove. So that will further inject the toxin to the victim's body. Because there's a sac of the poison sac in the back of the insect that is full of poison, that is toxin. If you squeeze and pull it out, the more and more the remaining toxin will be injected and patient will be more poison. And correct method is, in the second picture I have mentioned here, take a credit card or any type of the cardboard, any glass items, blunt glass items, and scrape and remove the stings in a vertical angle. That is mentioned in the second picture. But in the third picture, this is actually a picture description. If someone is trying to pull it out and freeze and pull it out, the poison is further injected. So early monitoring of early and late allergic reaction to be vigilant. This is also one of the important things. Correctly, this is whole blood clotting time. We all know that this is one of the basic bedside tests. Some of the occasions this is misguiding, but if you have done it very correctly, this is very informative and low cost, and the clinician can take correct decision at the correct time. Usual procedure is, for that we should use clean and dry 5 ml glass bottle. Glass, it should be glass. So avoid plastics and use to soap clean that glass tube, because it will be misguiding. Right? Pseudo negative and pseudo positive results will be there. Collect 2 ml of blood, and in addition to that, keep it undisturbed for about 20 minutes. At the end of the 20 minutes, the tube is tilted and absorb the clotting. This is the way. If no clot is there, test is said to be positive. The coagulopathy is there, patient has features of endonemation. If it is clotted, test is negative, coagulopathy is negative, no features of endonemation. But this should be, all the things should be, clinical decision should be taken with other physical signs and other investigation, that is a clinician's part. So any discrepancy, as I mentioned previously, to be interpreted with clinical signs and lab tests like INR and other lab tests, or WBC, DC and those things. And if whole blood clotting time 20 minutes negative, still you can't rule out the envenomation. That should be kept in your mind. So it is advisable in a suspicious cases, repeat it 2 hourly. But in hump nose, this is very one of the commonest serpent in Sri Lanka, hump nose viper, that should be repeated every 6 hours for 48 hours. Usually the hematological complications are very unlikely in a hump nose. But for example, in a first whole blood clotting time, if it is 10, in a second one, if it is 12, third one, if it is 14, like that, the clinicians know that some complications is going there. Microangiopathic hemolytic anemia, there's a clue there, and the patient is a risk category in the getting the acute kidney disease. So how to dissolve the antivenom? This is the last segment of my slide set. And usually the polyvalent antivenom is available as lipolyzed, that is as a powder. Usually it's available as powder. So first of all, as a nursing officer, you must verify the expiry date, because we are importing most of the things from other countries, and you must familiar the usual color, and if it is this color, you must inquire from the relevant authorities regarding the color change and expiry date. And shake the powder well to make the particles before dilution, because this is all the crystals has been thoroughly adhered. So if you add the distilled water initially, it is not dissolvable very correctly. So you have to shake it well in a dry situation to get the smaller particles. After that, take a syringe and suck out some air from the vial, and that will create a vacuum inside. After that, the distilled water, pre-prepared distilled water vial is there in all the packets, and enter the distilled water through the wall of the tube, wall of the bottle, and that is the best way to make it well dissolved. And in addition, you must rotate the content by your hands and palms actually, and avoid vigorous shaking. Most of we are used to do vigorous shaking. That will create froth formation. If the froth is formed, the most of the medicine will be difficult to suck out from the vial. So always we have to adhere to the manufacturer's instruction, because we are importing these things from India, various kind of companies. So we have to adhere to the manufacturer's instruction as well. So usually we are giving for the 20 vials for the patients. So if 10 ml is added, that's altogether 200 ml of antivenom is prepared. That should be prepared immediately if it is indicated. After that, get a 500 ml of normal saline or dextrose or Hartmann solution drip, and initially deliver fast before adding that antivenom 200 ml, because most of our patients are dehydrated at time to come to the hospital. After that, remaining 300 ml normal saline, for example, to be added 200 ml of antivenom. So the total vial is 200 plus 300, 500 ml of antivenom solution. Use dissolved antivenom solution as soon as possible, because you can't keep after using it. Be vigilant regarding the allergy and anaphylaxis. If anaphylaxis develops, you must help the medical team to manage it and stop temporarily until the management is completed. For example, if a patient's management, if the management of anaphylaxis take about 15 minutes, try to continue the rest of the antivenom within 45 minutes. So altogether, we must try our best to continue deliver the antivenom solution within 1 hour period of time. So this is the summary actually, what I in my short discussion, and update the clinical documentation in BHT help to minimize the complication. So this is very important, because updating can take the due time decisions for the clinician regarding the complications and other parameters. In addition to that, you must familiar the basic principles of management of anaphylactic reaction. Most of the deaths happening during the anaphylactic reaction, which is 100% preventable. Take quick measures to minimize the absorption of toxins by various kind of things, by correct removal of things and washing, and those practices can be applied. In addition to that, nurses should know how logically prepare the antivenom solution without froth formation and adhering to the manufacturer's instruction. So, skillful nursing care practice will minimize the mortality and morbidity. So, this is the message I want to give today. Thank you very much.